Good afternoon, friends. I, Dr. Abhishek Moge, welcome you in this part of the video. I hope you are enjoying this program and would be benefiting from it as far as our fight against this pandemic is concerned. Whenever we learn something new, we get queries. And to get a better idea on the matter, we need to clarify those queries. And to facilitate just that, we are fortunate to have Dr. Brigadier Rajan with us, who is an army vet and with considerable academic experience, as he was on the faculty of Armed Forces Medical College for many years. Today, he would be answering the queries as an experienced clinician. I welcome you, sir.
Thank you, Dr. Major Abhishek Moge. Like me, you are a veteran and you are also a fellow medical professional. I am very happy to be on this program to answer the queries of students and staff of the Symbiosis University. And I think I may be using layman's language during our conversation for the benefit of students and staff. I suppose you will have to put up with it. We can proceed with the discussion.
First question, sir, is what is the meaning of pandemic and is it similar to epidemic?
No, they are not similar. Both concern infectious diseases. A pandemic is an infectious disease which affects many countries or the whole world, as it's happening with COVID-19 now. Whereas an epidemic is an infectious disease which affects one country or a part of a country or a district or a village or a particular locality. It doesn't spread beyond that, and that is why it is called an epidemic. An epidemic becomes a pandemic when it crosses international boundaries. Further going down the line, you have a term called endemic, where the disease is confined to one particular locality and doesn't spread out from there. And finally, we have sporadic, where a disease occurs here and there without any connection with each other within the community. Those are the different categories, and what we are dealing with as far as COVID is concerned is a pandemic.
Next one is this pandemic something new or were there pandemics earlier also?
Unfortunately, mankind has had to face a lot of pandemics. Before this, the pandemic that we faced was about 100 years back, the so-called Spanish flu and also the Russian flu. And even before that, if you go to the Middle Ages, we had what is called Black Death or plague, which affected many parts of the world and killed nearly half the population of Europe. And it went on for several decades. And so mankind is not new to pandemic. There are pandemics mentioned even in the Bible. And therefore, it's nothing new as far as pandemics are concerned. But what is new about pandemics is that nowadays the organism causing or the germ causing the pandemic is new.
Right.
And these have not been recorded before, like cholera, plague, smallpox, Ebola. COVID-19 was not there any time in the past, but it has come now. Like that, there are many viruses which are coming up now as to create an epidemic or a pandemic.
Right. But why does this pandemic happen, and is there something we can do to prevent them?
Yes, we can, because pandemics are usually due to infectious diseases, and infection is something which spreads from one person to another. And therefore, if we can stop the spread from one person to another, from one locality to another, from one country to another, we can definitely prevent an epidemic from becoming a pandemic. But it calls for forethought, planning, and strict adherence to whatever has been insisted upon by the health authorities.
Okay, a student is asking, I have read that coronavirus is the same virus that causes common cold. So, If that is true, then why is it causing such health concerns now?
Good question. Actually, cold virus and coronavirus are not same, but they belong to the same family. You can say that they are cousins. And you find that the cold virus has been with us for a long time, and the human body is used to it. Whereas the coronavirus is something new, though it belongs to the same family, and human beings do not have any immunity to it. That's why it shows much more virulence. It's a new kind of virus, and therefore, till humanity gets acquires immunity or gets natural immunity against it, it will remain virulent.
Right. Now, it's a subpart of the same question. Since you said that this virus is not something new, then why do we not have any treatment for this viral disease?
Viruses, most of them do not have specific treatment at present, in the present state of medical knowledge, of the present state of modern medical knowledge, unlike bacteria. In bacteria, we can control, in bacterial infections, we can control the infection with the help of antibiotics, and sometimes we have specific antibiotics which will work against a particular bacteria. But most of the viruses, we do not have any such treatment available to us. Take, for example, chicken pox. Once you get chicken pox, it has to run its course. Once you get infectious hepatitis, which causes jaundice, again it has to run its course. Most of the viral diseases run their course till the body fights itself out of that particular infection. Viruses have to be managed better by prevention. Viruses are quite amenable to vaccines, and vaccines can prevent virus diseases from spreading.
So, the next question is, I have heard that this coronavirus, a student is asking that, I have heard this coronavirus has come from animals like bats, and if there are bats around my place, can they give me this coronavirus infection?
The answer to that question is, it's not conclusively proved that the coronavirus has come from bats. It could be, it may not be. It started in Wuhan in China, where there is a very big virology lab, and there is also a market which sells all sorts of food products, live food market as it is called, like fish and bats and various other things. So, it's not yet clear whether the virus started from there. Whatever may be the reason, it is not possible for a bat to directly transmit infection to you if you live in the vicinity of bats. So, one need not worry about that.
Next is, why is it that among all the people who get infected from coronavirus, only few of them develop symptoms, and even lesser number of people sometimes lose their lives, even though the virus is same?
The answer to that question depends upon the severity of the infection. As you know, doctor, that out of 100 patients who get COVID, 70 to 80% recover with hardly any treatment, just some paracetamol and rest and plenty of fluids is enough to get over this. About 10 to 20% require hospitalization. Out of that, less than 5% become seriously ill. This is because of the difference in the severity of infection. And the severity of infection again depends upon three factors: the severity or the virulence, as we call it, of the virus, and the immunity or the resistance power of the individual, and the environment in which this happens. Let me give an example. If there is an old man with an impaired immunity and he is also suffering from diabetes or high blood pressure, he is likely to get a severe infection, whereas the same virus in the same house, it can affect a young man who will hardly feel any symptoms and be fine without even any treatment. So, the severity depends upon the virulence of the organism and the resistance of the individual and the environment in which this occurs.
Right. So, next one is also about the infection. What is the reason behind this virus affecting mainly the lungs?
Viruses have affinity to certain tissues. For example, the hepatitis virus affects the liver. The rabies virus affects the brain. The herpes virus affects the peripheral nerves. The COVID-19 virus has a special affinity for the respiratory system, and the respiratory system, starting from the tip of your nose right up to the terminal alveoli, and it has got the ability to attack them specifically, and that is why it starts attacking the lining of the nose, and you lose the sense of smell very early in the infection, and that is why the lung is more affected in COVID-19 infections than other organs.
Next question is, I think we all are wanting an answer to that. When will this pandemic end, sir?
It's a difficult question to answer because it depends on us. The moment we let down our guard and start giving throw all precautions to the wind, like wearing a mask and washing hands frequently with soap and water and keeping social distance, if we don't follow these precautions, then you find that the cases come up and we call it a wave. But apart from that, there is another reason why you get a second wave and a third wave, because the viruses, like even bacteria, undergo what is called mutation. In response to the surroundings, they change their structure and their behavior. And when the structure changes, it becomes more virulent. If it does not become more virulent, it dies. If it becomes more virulent, it survives and attacks more human beings. So, one part is mutation of the virus, and other part is we people providing a ready population for the virus to affect. So, if both these things are taken care of by proper precautions, I probably in the next 6-8 months or a year, this pandemic should end. Because even previous pandemics like the Spanish flu had about 3 waves, and we have already finished 2 waves in India, and I hope the third wave will be the last one, if at all, if the third wave comes. But then the Russian flu, for example, had 5 waves. So, it is not possible to predict exactly how many waves will be there, but let's hope and pray there will be about 3 waves, and if we all observe precautions and get sufficient number of people get vaccinated, then this pandemic will certainly be controlled. Having said that, there is a certain thing called herd immunity. That means in a given population, if say 60 to 80% of the population have got protection against the virus, the chances of that virus spreading in that population is much less. So, how to get this 60 to 80% immunity? One way is vaccination, and the other way is people who have already had infection. If both these numbers together come to about 60-80%, the chances are that the pandemic cannot progress in a particular community.
So, this means that our behavior also plays a very important role as far as the…
Of course. And you see, basically the COVID-19 virus spreads by droplets. When you speak, when you cough, when you sneeze, it comes out of the person who is affected with the virus, and it goes to the other person's respiratory passage, or it goes and sits on surfaces. And from that surface, when you touch that surface, you pick up that infection and convey it to your respiratory system. So, it's very important to see that we maintain social distance, we wear a mask, and wearing a mask means wearing it properly, covering both the nose and mouth. I find many people roaming around with a mask hanging around their neck as if it is some kind of a garland or an ornament. That is not going to protect us. It is not going to protect the person who is doing it or the other people. So, it's our social responsibility to wear a mask properly. And a simple technique of washing hands with any soap and water properly for 20 seconds whenever you have gone out and come back, or whenever you have touched some surface which is suspect, is quite a safety measure, and that can save a lot of infections. And if we follow these precautions, by following these precautions, many countries have overcome this pandemic.
So, we have seen this virus is mainly affecting old age people, like you said, and adults, and not so much in teenage group people or children. So, according to you, what can be a reason for that?
A word of caution, doctor, that children and teenage people are not 100% protected. They are less likely to get affected compared to old people, and old people are not also 100% affected. Many old people also escape. So, it all depends on the level of immunity of that person. And as you know, as we grow older, our strength of our immunity comes down as a natural aging process, and therefore we become prey to various infections. Why even other conditions also affect the old people more, because of the declining level of their immunity.
Okay, so now since we are talking about immunity, is there anything you can suggest which people can do to maintain and increase their immunity?
Doctor, there are two, as you very well know, there are two types of immunity. One is called the general immunity of a person. The other is specific immunity to a disease. To give you an example, if you have had chicken pox, the chances are you will not get chicken pox again. Extremely rare to get another attack of chicken pox, because your body has got specific immunity against chicken pox. So, this specific immunity can be acquired in the case of COVID-19 either by suffering from the disease or by taking a vaccine. 2 doses of vaccine, whichever vaccine you are taking. With these two methods, you can develop a specific immunity. But the immunity that we get in COVID-19 is not 100% like we get, for example, after smallpox vaccination, because you find that the virus of the COVID-19 is much more subject to mutation, and it is much more subject to variation in its behavior, and therefore vaccine or a one-time infection is not a guarantee against a second infection, because the specific immunity given is to the individual is not 100%. The other type of immunity we have is called the general immunity. That means you can fight against any kind of infection which tries to enter your body, and that fighting can be done by improving your general immunity. And the general immunity is connected with general health. And by general health, I mean if your weight is normal, you are not fat or too thin, and if you exercise regularly and you are physically fit, you eat nutritious food, not junk food, and sleep properly, and keep your mind calm and happy as far as possible, peaceful, then it is scientifically known that your immunity is better than a person who does not do all these things. Therefore, it's very important during this pandemic that all of us should try to see that our general immunity is built up by these simple methods of following reasonable amount of exercise, proper diet, getting adequate sleep, and of course keeping our mind calm and peaceful by resorting to certain hobbies like listening to music or doing some painting or whatever is that which gives you some peace of mind. All these things will help you in building the general immunity. Both are important, general immunity as well as specific immunity.
Right. So, thank you for that elaborate answer, because we are actually looking for building up the immunity for last 1.5 years. Now, the next question is about something that we had never heard of before this pandemic, and that is lockdown. So, in your opinion, sir, are there any benefits of them? I mean, do they really work?
Certainly, in a pandemic situation where the infection is spreading through the country like wildfire, lockdown is an immediate and effective method of restricting that spread, because once you impose a lockdown, the number of people coming together, coming in contact with each other is reduced. And once that is reduced, the chances of spreading the infection from one person to another is also reduced. And therefore, lockdowns are important. But lockdowns alone will not be sufficient. Right. At best, lockdowns with proper precautions can help us in tiding over a crisis for a few days or weeks. But longer than that, it has got other socio-economic sequelae which are inimical to the welfare of the society. So lockdown has to be used judiciously.
Right. A student is asking, in the circle of my family and relatives, I have seen women getting affected more with the coronavirus than the male members. So,
scientific study does not show that. Scientific study shows that men and women are equally affected by COVID. And in fact, the more serious cases occur in men. And therefore, the observation of the student may be a chance occurrence,
okay,
and therefore should not be taken as applicable to the rest of the community.
Right. Now the next question is from a person who loves sports. He's asking that I know that after doing exercise one gets breathless, and the breathlessness is a very common symptom in this infection also. So how to make out the difference between the two?
Oh, it's a very good question, because there are two types of breathlessness. One I call as healthy breathlessness, which all of us feel after we have taken a good exercise, played football, played tennis, basketball, or went for a jog. That time we feel breathless, but we don't feel distressed. We feel comfortable, and that breathlessness settles down. The other type of breathlessness is an unhealthy breathlessness. This unhealthy breathlessness is due to a disease, whatever it is. It need not be COVID-19, it can be asthma, it can be some other lung infection, it can be heart problem. So many other problems can cause this breathlessness. That breathlessness comes on even without exertion. That means even with ordinary exertion, you walk 100 meters and you feel breathless, which is not normal for a healthy person. So that kind of breathlessness is what you have to worry about. The breathlessness which is expected after exercise or games is healthy breathlessness, and one should not worry about it.
Okay. Next one is again about the sports. Can this infection be transmitted by swimming pools?
The immediate answer to that question is no, because this is not waterborne. It will not stay there and catch somebody else. But what happens in a swimming pool is we come in close proximity, and you can't do swimming wearing a mask. And therefore, it is possible that in a swimming pool, the chances of transmitting the infection from one person to another is much more. And we find that in India, many of the swimming pools are very crowded. And therefore, that's another reason why we should avoid swimming pools. The same thing holds good for gymnasium. In the gymnasia also, you find there are a number of people, and this number of people will easily transmit the infection to each other. And many of them don't wear a mask inside the gym because they are exercising. Therefore, I would say gymnasia and swimming pools by themselves do not transmit the infection, but they provide a situation where there is crowding, and therefore they can transmit the crowding without mask, and therefore they can transmit the infection.
Sir, next one is an important question, and at the same time it's very interesting. It has got two parts. I will request you answering the first one. How alcohol based sanitizers work, and which one is better, hand rub or a spray?
Alcohol based sanitizers usually contain about 60 to 70% of ethyl alcohol, and this, when it comes in contact with the virus, it destroys the virus cell wall, and therefore that is how it is effective when you use it against the surface. Now when you are using it for sanitizing your hands, a rub is better, whereas when you are using it for surfaces, spray is better, and therefore both are required.
Okay, so second question is that is the interesting part. He's asking that if alcohol kills the virus, then consuming alcohol should also be working?
Unfortunately, I have to disappoint the person who asked this question, because I don't think consuming alcohol will kill the virus, because the consumed alcohol goes to your stomach,
Right.
whereas the virus is in your breathing system. So it cannot come to the breathing system from your stomach. By the time it comes to the breathing system, it has already changed its chemical nature, and therefore it will be ineffective. And secondly, it can have adverse effects on your brain, and therefore your behavior might become a little dangerous for as far as COVID is concerned. Therefore, intake of alcohol is certainly not going to help in preventing COVID infection. This reminds me of what the former President Trump said in United States,
Yes.
that if the sanitizer is good to kill the virus, why not drink the sanitizer?
Yes. Okay, so next one is can this infection be spread from me to my pet?
No. The viruses are usually what we call in medical terms as species specific. That means what affects human beings cannot affect dogs, what affects dogs cannot affect human beings. So the question of spreading to dogs is not to be feared at all.
Okay. Now this one is a little on a serious note. A student is asking, he's saying that I have realized that over this period of past 1.5 years, my sleep and appetite have gone down. So is this a normal phenomenon, and can I do something about it?
If I understand the question right, I think the student has been affected by lockdown. And during the lockdown period, our movements are restricted. And we are stuck at home most of the time. And therefore, the tendency is to exercise very little and eat whenever we want and sleep whenever we want. And therefore, the entire daily cycle has been affected. So the answer to that is this is quite normal in lockdown, and it can be prevented by being wise about continuing to exercise even though you are in the lockdown, continuing to eat wisely even if you are in lockdown, and continue to sleep at fixed hours even when you are in lockdown. And that is up to us to manage. For example, just because you are locked down inside the house, it does not mean you cannot exercise. There are various exercises available. Most of us are glued to the TV. The TV comes out with a lot of good programs on exercising. So we can look at those exercises and carry out exercises within one room. Enough exercise to keep yourself fit, and that can be done on a daily basis. Once you do that exercise on a daily basis, including yoga, you find that your appetite improves. And just because you are sitting at home, you should not have the take the liberty of eating whenever you feel like, snacking every hour, or not eating at lunchtime properly. Eat at fixed hours, and therefore your appetite will improve. And same way, if you do all this, sleep also will come at the proper time. And mind you, as we discussed earlier, if you do the diet, exercise and sleep properly, that will improve your immunity also. Therefore, it is not only good for you, it is essential for you to do these things so that you can fight the infection better.
Right. Next one is it true that we should not eat non-vegetarian food because of COVID-19 disease?
Not at all. It does not spread through non-vegetarian food, but it is possible that if you get ready-made non-vegetarian food from outside, the surface of the package may contain this virus, so you may sanitize that before opening the package. A properly cooked non-vegetarian food kills all the viruses, and therefore that cannot transmit the infection. Either you cook it yourself or buy what is properly cooked and eat it recently properly cooked food, non-vegetarian food, cannot transmit the infection, so you can rest assured about that.
Okay. The next question is, as we know that this pandemic has affected the economies all over the world, So, this question is something about money. So, this person is asking that if this virus spreads from one surface to another, then it can happen via currency notes exchange and coins also. So, how to sanitize these things?
It's a very relevant concern because coins and currency notes are handled quite a lot by a number of people. So, who has got COVID and who has left the coronavirus on it, we cannot say. So, it's better to treat all of them as potentially infected, probably infected. Having said that, it is best to avoid dealing in coins and currency notes and try to have online transaction, monetary transaction, so that you don't have to handle currency and coins. But there are situations where you cannot avoid currency notes and coins, in which case coins are easily sanitized, but currency notes difficult to sanitize, because if you sanitize you are likely to damage them and then they will become probably invalid currency. So, the best option in those circumstances is to put that currency away and wash your hands. And again, after you handle that currency, again wash your hands. That is the way you can prevent the spread through currency and coin notes.
Okay, I hope this will solve his problems. Next one is, we have seen that we are supposed to do appropriate behavior as far as COVID is concerned. So, the question is, can I get this infection even after following all those measures?
Yes, you still can get the infection, because if in spite of following all these precautions, you are exposed to a very severe dose of the virus, you may get the infection, but the chances are much less. Chances are definitely much less if you follow these precautions. Because there is no 100% guarantee that the virus cannot come to you if you follow these precautions.
Okay. Now, about the hospitalization, a person is asking that he thinks that if someone is getting admitted to a hospital in this scenario for anything like surgery or some investigation, so that person will surely get this infection. So, is it true?
Not at all. It is, on the other hand, I find that most of the hospitals do not mix up COVID and non-COVID. Some hospitals have stopped taking non-COVID patients when they are treating COVID. Some hospitals take only non-COVID patients. I know for some delivery hospitals which take only non-COVID patients. Then there are hospitals which take both COVID and non-COVID, but they follow strict isolation. They keep the COVID patients separated, isolated from the non-COVID patients, and they check whether the patients coming in, even if they are coming in for something else, have got COVID or not. They test them, and the non-COVID is separated. So, there is no way, if you are going to get admitted to a hospital for surgery and you are not infected with COVID already, that you are going to get it from the hospital.
Okay. Now, this is again something about something new that we have seen in this pandemic. Is there any fungal infection that is causing this infection, or something? Can you throw some light on that, sir?
Yes, I think there is a lot of fear among the people about this black fungus, what is medically called as mucormycosis. Fortunately for us, the mucormycosis is a very rare complication. It does not cause COVID. It is an effect of the disease in certain patients. As you know, COVID itself affects only about has affected only 3% of our population. Out of that 3%, only about 5% become very severe. Out of that 5%, a very small percentage become victims of this black fungus or mucormycosis. And who are these people? These people are those who have impaired immunity, old people, and people with diabetes, people who are on heavy steroid treatment. Only such people get this black fungus, and therefore most of the fear connected with the black fungus is not justified.
Right. And as we are talking about this infection, fungal infection, it has it has been seen mostly affecting the eyes, and most of the people, as you rightly said, that have low immunity. So, is if someone has this mucormycosis, the chances of that person losing the life is how is that? I mean,
Definitely, if somebody gets mucormycosis, the chances of his losing life is more than one who does not get mucormycosis, because mucormycosis is a clear sign that that person's immunity is grossly compromised. And therefore, now we know this very well, and therefore, people are taking precautions to see that diabetes is properly controlled, steroid is not used unnecessarily, and by this we are trying to prevent mucormycosis. And once mucormycosis sets in, there is treatment available. It's very expensive and very difficult treatment, but treatment is available. Does not mean every mucormycosis case dies, or does not mean every mucormycosis case results in losing the eye. So, it can be treated, but better to prevent it.
right. So, that does not mean that if someone gets COVID-19 infection, he or she should be started on preemptive antifungal for this.
Not at all. In fact, even precautionary treatment with steroids is not required, and definitely precautionary treatment with antifungal is not required at all.
Okay. Now, a second question is about this infection being transmitted by mosquito bites, because this virus is in the bloodstream. So, can it be transmitted by mosquito bites?
The virus cannot survive in the mosquito, because the mosquito cannot get infected by COVID, and therefore, it cannot transmit this infection.
Okay. Why is that in our country few areas or few states are more affected than the others? So, what can be the reason for that?
Not only in our country, across the world you find that all countries are not affected equally, and within our country also all areas are not affected equally. There are a number of reasons for it. One is the density of the population. Denser the population, greater will be the chances of infection. Take the example of Bombay, Pune, Delhi, Chennai, Bangalore. These were the places which were affected very badly by COVID because of the density of the population. Take places like Mizoram, Arunachal Pradesh. They did not have very severe degree of infection because the population is thin and spread out and the density is much less. Also, the way in which the precautions are followed, that is another reason why there is a difference in the incidence of diseases in different, the percentage of people affected in different places because of the precautions that they follow. If the population is careful about following these precautions, then you find that the chances of that infection spreading in that population is much less.
Okay. Now, it is about the vaccination, about the young population. So, when will the young population get the vaccine, and will be when the young population would be able to live like pre-endemic times, like there would not be any binding on wearing a mask or maintaining a social distance?
The question of throwing away the mask and all the precautions is unfortunately that time is very far away. What we have to do right now is to see that maximum population is vaccinated, and young people, the scientists are working on it. Very soon they will be coming out with vaccine for the young people, and as soon as it is available, it will be used, and young people also will be protected. But we must remember that vaccination in COVID-19, as it is in, for example, in smallpox, is not 100% effective. At best, you can compare it to the seat belt in a car. The seat belt in a car does not prevent accidents. It only makes sure that if there is an accident, the injuries are not severe. Same way, when you are vaccinated against COVID, it does not guarantee that you will not get COVID infection. All that it does is that if you get COVID infection, it sees that it does not become a very severe variety. It will be a mild type of infection. So, it is important to have the vaccination, 2 doses of the vaccination at the appropriate time, and 3 weeks after the second dose, your immunity starts kicking in, but it does not mean you have 100% protection. So if you want added protection, you have to continue following these precautions. Only simple 3 precautions: mask, proper mask, frequent washing of hands with soap and water as required, and third one is social distancing. If we do that, that will be an added protection.
So the masks are not going anywhere now.
Or not yet.
Okay. Next question is again about something related to vaccination. Now the person is asking that if even after getting fully vaccinated, like currently we are giving 2 doses, can a person get infected with coronavirus, and if there is a possibility of infection, then after that infection, when should the person again take the vaccine, or what is the guideline for that?
As I explained in the answer to your previous question, doctor, the vaccine for the coronavirus is not 100% effective. And therefore, there is a chance that there is a breakthrough infection, as we call it, that in spite of the vaccination, the patient may get an infection. Such an infection is usually mild. And so there is nothing so frightening about it. And in addition to that, we find that you have to, if at all the person gets another infection, he has to wait for at least 6 months, 4 to 6 months, before he can think of vaccination again. Before that, the level of the antibodies in his blood can be checked, and we can find out how much is his specific immunity against coronavirus, and see if another vaccination schedule is required or not in that particular case.
Since we are talking about vaccination, I have a question for you. Like we are talking about children not getting vaccine for COVID-19, but somewhere I have heard that some child specialists are saying that they should take some influenza vaccine, for example, which will give them some kind of cover against this, because it's also a kind of flu. So is that correct, or what is your opinion on that?
I have not read anywhere in a scientific journal that influenza vaccine, flu vaccine, can protect a child from COVID-19, because the viruses are quite different, and even the flu virus changes its virulence and its composition and its nature every year. It undergoes a lot of mutation. So I do not think that flu shot is likely to give you protection against COVID. And why go for a flu shot when you got vaccine against COVID? And for children, the vaccine is coming. It's better to wait.
That's true. Now, actually, you have spoken a little bit about the waves. So the one question is that what is the reason behind second wave, third wave, fourth wave, and is it a normal phenomena, like it happens every time? So because if it is happening every time, so maybe it is not cause of concern, or still it is a cause of concern, and how to handle these waves?
As far as the waves are concerned, it is known that when pandemics occur, they do come in waves. For example, the Spanish flu about 100 years back had 3 waves, and the Russian flu had about 5 waves. So wave phenomenon is known, and there are 2 reasons for this wave. One is when people get infected in a community, they take precautions, they get worried, and they follow isolation, and you find that the incidence comes down. Once the number of cases starts going down, people let go their precautions, and therefore the cases go up again. We call it a wave, but what has happened is we have stopped taking precautions, and therefore the cases have increased. This is one part of it. The second part is the virus itself undergoes modification. The virus, as you know, undergoes what we call in scientific terminology as mutation. It is exposed to a large number of people, and therefore some of them start changing their structure and changing their virulence, and usually they become more virulent, and therefore you find that there is a second wave or a third wave.
So, this mutation you said, so is Delta variant that we are hearing now, that it is causing second wave or third wave in some countries. So, is it the same thing?
Yes, it is. Delta variant is because of a mutation of the COVID-19 virus. In other words, the same COVID-19 virus has come with slightly different structure and is able to attack you. That is why it is called a Delta variant. It is a variation of the same virus, and it can show further variations in future, because viruses are trying to survive in an hostile atmosphere. I think it may be an appropriate time to talk a little bit about viruses. Viruses and bacteria are quite different. Bacteria are much bigger in size compared to viruses, but bacteria themselves are very small. For example, a pinhead can contain hundreds of bacteria, but each bacteria can accommodate something like hundreds of viruses. That's how small they are. Apart from that, you find that bacteria have the tendency to cause a specific disease and can be treated with antibiotics, whereas viruses, they have to run their course, and it is very difficult to have any specific treatment against virus infection. The second part is, though bacteria also undergo mutation, mutation is much more common among viruses, and therefore you find that viral diseases take different forms, and it is difficult to keep predicting what sort of variation or what sort of mutation will occur, and that has to be kept in mind when we are dealing with viruses.
Next question is about something about the symptoms. Like we know that dry cough is one of the symptoms of COVID-19 disease, or some people are normally having some kind of allergic reaction. They go out in the environment and they start having allergy and they start having cough, and similarly common cold also. So, these symptoms are similar to in COVID-19 disease and otherwise in normal disease processes also. So, a common person who does not have a medical knowledge, how he or she can identify these symptoms, that yes, this may be COVID-19 or this may not be COVID-19.
Before I answer that question, I would like to say there is a lot of unwanted fear about this COVID-19 infection. That fear first of all must go. We discussed earlier that 70 to 80% of COVID-19 infections are self-limiting. They don't need any severe treatment, no hospitalization, you become all right. And it's only about 20% which may need hospitalization. I find a lot of people unnecessarily rushing to hospitals, clamoring for beds, or insisting that the doctor admit them and give them treatment. And even the slight illness, I think it is better to wait. So, a person who is not a common man need not think it is COVID as soon as he gets a cough. If he has been exposed to COVID in a near relation or a friend, and if he has developed the symptoms after 3-4 days, and the symptoms are with fever, loss of smell, loss of taste, and cough, and he may think that he has got COVID. And even then, he doesn't have to rush, because even at that time, a swab test will not tell you whether he has got COVID or not. So, you can wait safely for 24 to 48 hours, see if the fever goes away, and if the fever has gone away, that's the end of the story. If it does not go away in 2 days, then you can approach a doctor. See, many of us, even when there was no COVID around, used to get a fever occasionally in the year for 1 or 2 days. We didn't run to the doctor. Probably our grandmother treated us, or we took some crocin and took some rest and told the office we are not coming today because we got some fever. And then if everything was all right in a couple of days, we left it at that. I think COVID-19 can be treated the same way, but beyond 2 or 3 days, don't wait. If you feel that the symptoms are continuing, then you can go and see a doctor. He will decide whether you need admission or not. Don't tell him I want this, I want that. You should start me on remdesivir. You must admit me. You must do this test. Unless we overcome the panic connected with COVID-19, our health infrastructure is going to be overstretched and is going to be overwhelmed as it happened in the first and second wave. And it does not mean that we should ignore this. We should be conscious about the infection, but at the same time not be careless about it or be afraid of it. So we have to follow the middle path. Be aware that you may be having COVID, but it's no big deal. Let me wait and watch for a couple of days, and if I'm still not all right, then I'll go and see a doctor. That should be our correct attitude.
Right. So, it's the choice between panic and prevention. So, sir, as you spoke about the panic, there is something called as, just like pandemic, there is something called as infodemic. So, this infodemic is also causing a lot of stress and anxiety in the population. So, can you tell something about that?
Yes, it's a very real problem, doctor, because we find that you can't spend even 10 minutes in a day without getting a WhatsApp message or some other message about COVID-19. I would say the best is to ignore all those messages. Take only reliable messages which you get from your doctor or which you get from authorized sources which are supposed to advise you. I have come across such atrocious statements on the WhatsApp and on other social media that people unnecessarily get panic, and even before they have understood what is the message, they insistent on sharing it to so many others, so that the panic is spreading. And so this infodemic is requires equal attention as the pandemic. I agree with you.
We have spoken about a herd immunity a little bit. So, a person is asking that I have heard the word herd immunity, and I have heard that if it develops, then there will be no more infection, there will be no more COVID-19 disease. So, can we do something at our end to bring this herd immunity in sooner, and how to control this? So, can you tell something about that?
Basically, when 60 to 80% of a population has got immunity against a particular disease, then we call it a herd immunity, because the organism, the virus, does not find it easy to spread in that population, because 60 to 80% are already protected. So, how to get this 60 to 80% protection? There are two ways. One is to build your general immunity, other is to build your specific immunity. Now, specific immunity we already saw is by vaccines. Take 2 doses of vaccine at the appropriate intervals, wait for 3 weeks after the second dose, you have a reasonable amount of protection. The other one is the general immunity, which, as we discussed earlier, everybody is responsible for his own general immunity by taking appropriate exercise, following proper nutritious diet, getting adequate sleep, and seeing that he remains peaceful and happy as far as possible, because all these factors are known to improve the general immunity in a person.
This is the final question, sir. This is about, I have got this question as we were talking, that some people say that they feel breathless when they put on a mask on their face, and as you explained that it has to cover from nose to your chin. So, when some people do it, they feel breathless, so that is why they hang around the mask around their necks. So, is that true that you should feel breathless, or it is just an excuse?
I think this excuse is not acceptable. Most of the time when somebody says he can't tolerate the mask, that is because he has got a mental reservation to wearing the mask. He feels uncomfortable breathing through the mask. If he cannot wear a mask, then he should stay in his room.
Right.
He should not come out, because it is our social responsibility to wear a mask. It is not for my convenience or my comfort. It is for the safety of other people that I am wearing a mask. And I know that most activities can be carried out with the mask on. I have been a surgeon, and I spent most of my working hours wearing a mask. I never had a problem. A lot of people in their profession wear a mask, And if general population is expected to do the same thing which others can do for hours together with a mask on, I don't see any reason why they should say, I become breathless, so I will not wear a mask. The answer for such people from me is, if you cannot wear a mask, don't come out, stay in your room.
Right. So that brings us to the end of this session. So before we wrap, sir, would you like to give some message to our community, sir?
Dr. Moge, I think most of the message has already been given. I would summarize by saying that COVID-19 is a real danger to the society. The way to tackle is not to be afraid of it or get scared or panic, or not to be careless. Follow the middle path of being conscious of it, take all the precautions, that is, wear the mask, wash the hands frequently, and keep social distance, and take the vaccine as soon as possible, and also build up your immunity by following regular exercise, diet, sleep, and keeping yourself happy. Wish you best of luck. Thank you.
Thank you so much for your time, sir. We have covered everything about COVID-19, and you have spared this time and shared your experience and expertise as far as this thing is concerned. On behalf of student community, I really thank you, sir.
Thank you, Dr. Moge. I hope whatever we have discussed will be of use to the students and staff.
Surely.
Thank you.
Thank you so much for watching this video. In this video, we covered everything from symptoms, treatment, vaccination, and other aspects of pandemic, COVID-19 pandemic, as well as any other pandemics. So thank you so much for watching, and I hope and believe that this is going to make a big difference in your lives as far as fighting this pandemic is concerned. Stay safe, stay healthy.